Okay, welcome to Azman podcast. Today we're going to talk about mental health, which is on the rise. And I have my guest, Dr. Muhammad Syahir.
Yes.
Welcome to my podcast.
Okay, hi.
Tell me, what is mental health?
Okay, so to everyone outside, to all the listeners, before we begin, just want to say thank you for inviting me. I think this is a good opportunity because in your community itself or in our community, mental health is in a rise. So I'm just doing my part, my small part to help awareness with other people and get the message out there so that everyone is aware of what's happening, what is really happening, and know that they are not alone, whereby help is always around the corner. So okay,
is it a serious problem now today?
Okay, mental health is a serious problem. Okay, so if you look at the statistics and the data a bit, mental health started to become really prevalent or really prominent, especially during the pandemic and also post-pandemic. Okay. So during the pandemic, everyone was in their houses.
Right.
They were trapped for so long. Income has been declining. People lost their jobs, retrenched many times.
I thought it was a good time, not.
It was a good time for a while, but it's also a good time for those, in my opinion, with money lah.
Okay.
Right. So when you have money, sure, you have not much worries.
Not much stress.
Not much worries. But to those who are not well or making ends meet, our day to day, financially, so these things started to put a stress on them.
But after COVID,
it's actually during COVID itself. A lot of people lost their jobs. Economy was down. Everyone was at home. We couldn't be productive in a sense. So that's one factor was financial issues, but also because when you were at home for so long, we as humans, we were created to not just stay in one place stagnant. We were meant to evolve. We were meant to be better than ourselves yesterday. So we tend to need to do things to survive, which is maybe the olden times where maybe people started hunting and whatnot. But for us today, we need to go to our jobs 8 to 5. We need to make money and we need to see other people. We need to communicate and we cannot just be in four walls. It's the same as, let's say, if you're in prison, you're isolated in four walls, you're institutionalized.
Right.
So many of us felt that.
But especially COVID time, you feel it's on the rise. Right?
Yeah, because people started to realize these things. Before this, I think because awareness wasn't there and people were able to distract themselves from the problems that they actually had, or because everything was just well. Let's just have good thoughts that, okay, everything was well for everyone. But only when you start to see these symptoms and you are unable to go out to seek help or to do the things you normally do, you realize that it's actually a problem. So that is why I believe since then, it's not that it has been spiking just on the rise because of the pandemic. Sure, it is a factor, but it's because only then people started to realize that this is actually a concern because it was post-pandemic. But pandemic is not the main factor. It's one of the factors. It's always been there.
But it's gone up because of it.
And a factor, yes. A factor.
In your work, do you find there is a rise?
Yeah, sure. But they won't say I was stressed. Okay, so during the pandemic, we're just talking about the pandemic first. There was the main issues that I was mostly addressed was burnout. Okay, burnout is a mental health disorder, whereby the symptoms it can vary from anxiety to tiredness to depression to sleepiness and whatnot, and unable to function, but it's usually because of work relations. So during that time, the healthcare workers they were in the front lines, so every day working 24-hour shift, 33-hour shifts, not going home and covering your friends and whatnot, and being spread out all over just to cater for patients, and we needed to make sure they were okay again during the pandemic though. So most of them suffered from burnout.
But could you see patients during the lockdown?
It was difficult. It was a difficult time. So during my the old place where I practiced, where I did my service there, one of the places was in Johor . It was very difficult. It was very, very difficult to see patients. We had to call them, and for mental health, we understand it's not something.
Scared because they, contracting.
Correct. We were scared, but the truth is, all healthcare workers were scared. I mean, we are still human.
And you have no choice.
It's your job. It's our job. It's not many. I mean, I believe that most healthcare workers during the pandemic, they didn't just think of it as their job. I think it was more of a service to the country. Because if we didn't do it, who's going to do it?
And the stresses that everybody goes through, looking on television, people dying, that is part of the especially the TV media portraying a lot of deaths, kan? So
Betul.
that one would put a mental stress on your mind.
Yeah, sure. Of course, definitely. I would say that's why in mental health, there is no one specific factor that will cause you to get one specific symptom or disease. It's always a spectrum of things.
So what is mental health?
Okay. So what is mental health like? Because I think we derailed a bit.
A bit.
A bit derailed lah. But it happens lah. It happens.
Okay.
So when you want to know what is mental health, it's basically, if we understand what is physical health, which is you take care of your body, all your physical aspects, your muscles, your bones, your hearts, your blah blah blah, that's physical health. Everyone understands that. But for mental health is the other component of it, the yin and yang of it. If the yin is your body, the yang is the mind. So of course, in the mind, the components, you have your spiritual self, you have your emotions, you have your thoughts, and you have your cognitive aspect of it. So these are the things where it encapsulates I would say what is mental health. But it's about general well-being, not just physically. That is, if I could answer the question is mental health.
Okay. And I understand there are many types of mental health. Can you explain to me what are the types?
Okay, so for those viewers or listeners out there, I'm sure you guys are very interested to understand what is actually mental health ni kan? Or what are the types. So I'm here to educate, to just give a bit of insight lah. During the olden times, mental health was a big taboo kan. So people will associate people with mental disorders ni as psychotic. Terus macam
all sent to Tanjung Rambutan.
All sent to Tanjung Rambutan. All sent to everyone was scared. Yeah, betul.
The idea of being from childhood, you think mental health is a taboo. We don't talk about it. Yeah. So is that a wrong idea?
That's definitely a wrong idea. That is definitely a wrong idea.
Right.
Mental health is a spectrum. So
you have to remove that taboo.
Yeah, we're here to remove the stigma that's been happening all across the globe. It's not just in Malaysia. Of course, if you see the demographics of it, in Asian population, there is a high stigma.
Okay.
Because we're much different from the Westerners, but that is another topic on its own lah.
All right.
So social demographics is an issue. Is one of the factors.
But there are degrees of mental issues, right?
Okay.
So people get confused about that. Yeah?
Betul. Yeah. So correct. So mental illnesses, in general, there are so many, but in general, for educational purposes, it's easy to classify them into 3 subtypes or 3 categories.
Okay.
So you have your neurotic cases, you have your psychotic cases, and you can have maybe personality cases or not the other two. Personality disorders. Okay. So we classically then there are more. There's so many other categorizations, but
the 3 main ones.
3 one in is for easier people to understand. At least they know. So these 3 things. So neurosis cases are macam the cases of depression, anxiety, all these mood symptoms. They usually are classified under neurosis. But if you're talking about psychotic cases, it's purely psychosis. It's the ones that we are always talked about when we were children. The olden times whereby you gila, you're not well. These are they would easily the crazy ones. They last time would classify them as psychosis, but to
those
diagnose,
are serious ones, right?
Those are serious ones. Everything has a serious. In each subcategory, there are always severity level. There are always different severity levels lah. Okay, but if you're talking about your psychosis per se, so these are the diseases such as schizophrenia. So schizophrenia is paling berat lah. Is the one that is the heaviest.
But you cannot tell.
It depends.
By looking at them, they've got they're schizo, right?
Actually, it depends. It depends because to diagnose schizophrenia, you have to fulfill a certain criteria. It's not easy. It's not like just because you see someone talking to himself, you're schizophrenic. It doesn't work that way.
Okay. Right.
So that's why the corroborative history has to be really detailed. We don't just take the information from the patient. It's always from around them. Family, friends, bosses, colleagues. What actually happened? How was this patient behaving the past month or so? So from there only we try to we will diagnose them based on the criteria, which is you have to have hallucinations and delusions lah. Okay, so there's a difference between hallucinations and delusions. Hallucination pun, if you go very detailed into it, there's so many more. So
this is inborn.
There is studies suggestive of genetic factors, whereby it's not 100% hereditary, but for any disease pun, even if you're not talking about schizophrenia, whenever we are taking history and whenever someone does have family history of X disease, any disease, the offspring will always have a higher risk compared to others without any illnesses in their family history. So it is a risk factor, but it's not a direct. It's not a direct causative agent. Okay, so that's schizophrenia.
Alright.
Then you have your bipolar in there.
Alright.
So bipolar pun, we can
It's
talk.
inside the schizophrenia.
No, it's inside psychosis. As in,
psychosis,
because bipolar is a bit different.
Right.
It's not 100% in psychosis, but it's not 100% in your mood disorders.
Right. This is quite common. I hear.
Okay, so
People,
bipolar.
you're bipolar. Sometimes somebody goes crazy.
Betul. So people nowadays, they tend to loosely use psychiatric terms.
Right.
Like they say, oh, I'm depressed.
Yeah.
So, but it's not easy to be diagnosed as depression. It's very hard. So some people, they think that just because they feel this emotion of sadness, they are depressed. But even for us, we do have our criteria. We don't just, so that's why it's important. History is very important to us.
You have to evaluate.
We have to evaluate.
Yeah.
We have, of course, we have our general scorings and we have our assessments that we do.
Yeah.
But based on history itself, you can tell a lot from a person.
Alright.
So let's say someone has been crying. You've seen your one friend crying the whole day.
Alright.
Before this, he's never cried. And let's say we just took that at face value. Like,
Okay.
he's crying. Is it fair to say he's depressed? Is it fair?
No, well, I don't know. You tell me.
I'm catching you off guard. No, let's say you had your friend.
Okay.
You saw me crying.
Alright.
Let's say I'm crying right now.
There's something wrong.
Something wrong. But would you say, are you depressed?
Yeah, I would, I suppose.
Okay. So it's okay.
It's okay to think that.
It's okay because we are not equipped. People
Alright.
do not understand.
Okay,
So this is why I'm trying to. This is the whole point of everything we're doing today again.
Alright, true.
Okay.
Yeah.
So because, but then you ask me and I say, oh, actually, someone passed away. I just got the news someone passed away.
Oh, okay.
Let's say. But I've been crying non-stop for one day.
Yeah.
That's why depression, it has to happen over a long period of time, for a certain period of time, whereby maybe there was a triggering factor then. Let's say someone did pass away for me maybe 6 months ago, but I'm still crying today. Yes,
That's depression.
then maybe you can diagnose them. But to me, I'll always say to the general public, never self-diagnose yourself.
Oh, okay.
It's good to understand the symptoms that you have. If you're
Alright.
feeling sad, you're feeling lost, you're feeling anxious all the time, you have palpitations and whatnot, you have terrible sleep. You may have the symptoms, but that does not mean you can be clinically diagnosed.
Okay.
The definition is already clinically diagnosed, whereby you need to be seen by a treating therapist.
Yeah,
Means
but you, as a public,
as a
layman,
public,
we can see the red flags, right?
can, correct. So you can
At
see
least
the
that's
symptoms.
all we can do
Betul.
to advise the person they need treatment or whatever.
Okay, betul.
Even that also we're not qualified, but we can. The red flag will identify something.
Betul, yeah. So as the general public or any family members or anyone in our population sekarang ni, whenever you do detect a red flag from your friends, colleagues, ke apa, always reach out to them lah. Never just let them be or just call someone. No, you reach out to them as best as you can. Don't be so intrusive lah. I want to get into your personal space. No lah. Give them the space that they need, but then the best thing we can do is offer support and also redirect them to the best help that they can get at their level. Either going to the hospital or if they have enough money, go therapist terus ke, get themselves betul-betul checked out. Because the symptoms are there. So because sadness is an emotion that everyone feels. So just because I'm sad doesn't mean I'm depressed. Because we have to feel it. It's normal.
Yeah. It's normal.
It's
actually.
normal. Yeah, but if
some people the degree is higher.
Betul,
That's where
betul, correct.
we try to identify, and even meet. If it's overdoing it, then you have to seek advice, I suppose.
Yep. Yeah, so that's the best thing to do lah.
The other one you were mentioned, psychosis.
Yeah, so even if the red flags of depression too, I mean everyone should know by now lah.
Right.
Sadness, macam wants to kill herself, no doesn't want to live anymore. But let's say those are red flags lah. But if psychosis ni, the red flags that you do look out for, number one, I think the easiest for the common folk to know is change in behavior first.
Okay.
That means in this category of psychosis, what we are worried about usually is change of behavior. So let's say he's been every day a routine, a somewhat fixed routine, 8 to 5, going back, coming home, weekends with the family. But over time, means it's an over period, a length of time, you realize, he's starting to talk differently, or he's being very irritable for no reasons. He's very paranoid, always scolding me. So that is change in behavior. So that is already not a red flag yet, but it's an indicator.
Okay.
A red flag, I would say, is once he starts presenting with psychotic symptoms, which
Talking
is
to himself.
talking to himself,
Really? Okay.
laughing
I
to
talk
himself.
to myself sometimes.
Okay, betul.
I'm angry. I talk to myself.
Betul.
Am I?
Not so. Okay, so
I
there's
could
a difference.
I could be crazy.
You could be, but actually no lah. Don't worry.
So,
Okay.
Okay.
So the public have to understand, even for hallucinations, there
Yeah.
are two different things. So people might think, oh, I'm going mad or something. No,
Yeah.
because so there's the thing where one is called a hallucination, the other one is an illusion. So let's say or let's say we are walking down the park
Alright.
at night 7 malam 7 PM dah senja, it's already
Yes.
there's a twilight time, you know, and then suddenly a white cloth just passed by. Let's say like for no reason, a white plastic bag.
Okay.
But because of the factors of the environment and the stimulus surrounding the situation, we think we saw a ghost.
Right.
So it's like, oh, am I going
Panic
crazy?
attack,
You panic ke apa, but you rasa you psychotic lah, macam you selalu nampak.
Right.
You always see that thing. So does that make you schizophrenic? No, because in that context, it's an illusion.
Right.
People who do experience these hallucinations, it's something where it happens without external stimulus. Means they will see it as it is. Tak payah, it doesn't have to be at night. It can be right now, even at
They
tengah hari.
believe they see something.
They don't. It's not that they believe, they do see something. Because the
But even that thing is not there.
even if that thing is not there, so it's different from illusion. Illusion is something plus something makes it look like something.
Yeah. Okay. Right. Illusion.
But if it's a hallucination, they see it as it is. They can describe what they are seeing. It doesn't change.
Is it spiritual or?
If you're talking about mental health, then it's not. It's actually a imbalance in hormones, in the brain.
Okay.
It happens.
People, of course, our people say hantu.
People will say hantu. Betul. So for us,
ghost and stuff.
betul. So there's a fine line lah between you nak kata it's religious ke ataupun it's pure psychosis. So memang it's quite difficult. That's why social demographics tu sangat penting. It's very important. We as doctors ke apa, it's not just chit chat macam tu. We actually dig very deep. Kata we have to understand exactly what is going on before we can say this patient is psychotic. So it's a deeper understanding. But so macam like you give me an example of you talking to yourself kan. It's normal. That one is called macam internal monologue.
It's normal.
It's normal because you're
also scared.
thoughts,
Sometimes I talk to myself while I'm driving.
No lah.
Okay.
Talking when we say
it's normal,
it's it's normal because you're just talking. It's
thinking
thinking out of your brain.
Fine,
so because some people they have to hear what they are thinking.
So when I'm hallucinating something in front of me, then it's different.
That is different. That means you will see yourself physically here, and you can talk to yourself. Means you're physically there.
That's scary.
That's scary. Yes. If you are, that's why for us we have a deeper empathy towards patients who do suffer this. No one wants to see things. No one wants to hear things. So these patients they really need help. So because we don't experience it, and especially the public who do not see, we see it firsthand. So we treat these patients as best as we can. So the public who do not see this, they think that you're just causing trouble in my life. Why are you hearing these things? But they don't understand. It's not their fault.
But
to a certain
these
degree.
things they hear, is it themselves telling them to do this and that?
It depends.
Is their conscience?
No. It depends. It depends.
There really is.
There really is, because it's a brain pathology. It's to put it in layman terms, is very difficult. I mean, it's very, very difficult. But it's as if it depends on the patient. Every case is different. It's not like this patient hears this thing, the other person also will hear the same thing. No. What they hear, it all depends on the issues that they are going through or the psychosis which they are experiencing. So it's very different. So we cannot classify it. I mean, I cannot say to everyone, this one's going to be like this. No, because it's very, very unique. So it's our job to have a deeper understanding to treat them better. So that's psychosis. So don't worry, you're okay.
Thank you.
You're well.
But I often think to myself, I say, am I crazy talking to myself? So thank you for saying that. So I'm not so bad.
Yeah, don't worry. If you were, no.
I'll be talking to you.
Yeah. We're off camera.
So what's the other psychosis?
So psychosis, and then you have personality disorders lah. So personalities ni pun you can break it up. There's cluster A, cluster Bs, and cluster Cs for personality. For example, macam if you're talking about cluster Bs, is your narcissist, your antisocials and whatnot. So these are cluster Bs. Then you have your cluster As and your cluster Cs.
But I thought narcissist is in everybody, right?
Okay, so it's everyone will have traits of something lah. Say macam I would say, I have depression traits. Contoh, sure, everyone will have some traits.
In a small way, there is.
But for us, that's why we don't like it when people loosely use these terms. Because for us, it's you have to diagnose them according to the criteria, which is understood by all practicing physicians or whatever lah. It has to be understood. This is the term. If we keep using this term loosely, everyone is going to be having something. So there's a problem with generation nowadays. Because of the accessibility of internet and Dr. Google, we tend to think we have all these things just because we read it. And sometimes there is a psychology aspect towards it. When you read it, somehow you relate to it. Even if it has nothing to do with you, you say, 10 years ago I had this symptom. So that's why it's never a good thing to self-diagnose. But so macam if you're talking
particularly for mental health, you need to ask professional advice. Because
definitely.
Taking everything from Google and YouTube also it's good to know.
It's good to learn. It's good to know.
I mean that is out there, the information, but but you cannot be the doctor to diagnose by yourself. You have to ask a professional. Yeah.
I believe it's always best to know, always good. Knowledge is the one thing you can never have too much of. You can never have too much knowledge of. But what's better is with the knowledge, you know at your level what can you do, and also when do you need to seek help if it is you, or when you should help your other friends to seek help. That's the best for anyone to do. So they should listen to podcasts macam ni, like this, or read up on their own, or go for talks and seminars, just to understand what at their level what is most important. They don't have to know all the physiology, what happens in the brain. It's a long topic. You study 5 years
forever. You don't need to know this.
Yeah, you don't need to know
Basically,
this.
how to handle and what to do. That's what we're here for, to advise you how to handle this sort of situation. Or give help to others as well.
Yeah, definitely lah. So
and personality disorder. What is it? Is it serious or not?
Everything in mental health will have a spectrum of it, except for your. Spectrum, if it's good, if it's treatable, if it's not treatable, blah, blah, blah. There will always be a spectrum lah. So even for personality disorders, there's always a spectrum.
I know the subject of narcissism because I know some narcissists. So
I see.
But apart from that, what other personal disorder you're talking about? Bipolar, is it?
Okay, so bipolar was it's not. It's not.
Fine.
So personality is a tricky one. It's a very tricky one. Memang even if
very vague, is it?
It's not very vague. It's very difficult to pinpoint exactly the diagnosis, because that's why we cluster them. Because they will overlap. So maybe with with narcissism, they might have some mood disorders also. They might have anxiety disorders.
Do you think they know they are narcissists?
So if you're talking about, if you really want to talk about pure narcissism, if by the disorder, they won't know. They won't know because they have a grandiose self-esteem of themselves. They have like macam high E.
Right.
They have a high thinking of themselves. So
they don't know.
And they cannot know if they are pure narcissism.
Alright.
Or they might know and they'll just They won't care.
They won't care.
Yeah. So it's hard to say, but but because narcissism ni dia complex sikit. Because to have the disorder tu untuk kita diagnose 100% is memang you have to be really bad already. Means you're already very severe. But usually most of the time we can just say yes, they have these symptoms.
If they have, they won't seek treatment anyway.
They won't seek treatment
because they think they are grandeur and they know everything.
If you're talking about the pathological narcissism lah.
Okay.
But if those people who have traits ke apa, they could just live a normal life. They just might have 1 or 2 symptoms, but because to fulfill the criteria, you need at least 5.
And you cannot, you as an outsider, cannot say this person is a narcissist because we're not doctors to know exactly, right?
Betul.
There are ways to find out if a person is a narcissist or not.
And even for any disorder, if you're talking about any personality or cluster disorders, memang even for psychotic cases or neurotic cases, you cannot diagnose. You as a public, you should not diagnose. Just identify what is of concern to you, what is the behavior change for us. Okay, so as physicians as any therapist when we do see these patients, what we most would appreciate from the family members or friends when we do take corroborative history is what is the change of behavior. That is the number one where if you can tell us that, would help us out a lot.
And the history.
That is part of the history lah.
Right. So betul. A lot of this goes back to the history, right? A lot of what's happened to them stems from
history,
past
what happened to them,
or trauma in the past.
Betul.
So and then after the trauma, they still live through that. And then they have to seek advice to get out of it. Am I correct?
Advice. Okay. So you're talking about treatment. Okay, so treatment.
So but let's talk about cause first.
Pardon?
Have we talked about cause yet?
Okay. So
what was one of the things?
So causes. We talk about cause first.
Otherwise, you're jumping the gun.
So we tend to derail when we're talking. So causes per se. Still ada banyak. So but for us, when we are taking the history, we're trying to understand, we will divide it into like a matrix. Use it biopsychosocial. So what is the biological causes, whereby let's say substance, this patient has been abusing some illicit drugs, amphetamines, opioids, so these are
the social drugs that
social drugs, they could be abusing these things, or even alcohol. Alcohol
also can
cause to a certain degree. So anything in excess can cause. So then you have your social factors, or your psychological factors, whereby previously they memang ada underlying
something happened in the past,
something happened,
a death, somebody close, or
Yeah, so or anything can be a factor, but for us, we would classify it into these things. So this is how we see things. This is how if anyone was wondering what happens, what do the doctors ask whenever a person is admitted to the psychiatric ward or sees. This is how roughly how they think. So we don't just see it at one symptom. We terus narrow it down. Let's say this patient came with sadness per se. We don't just narrow everything. It is probably depression. No, actually we have to think of a broader spectrum because we understand this symptom can overlap with this, can overlap with this, can overlap with this. So we divide all the other causes first, the risk factors which we believe either biopsychosocially, and then only we further branch out. That is why usually treatment for mental health per se is a long process. It's not like general medicine. Macam you demam. If you are sick today, I give you Panadol, probably you'll be okay in next few days. Because it's a 1 + 1 is a 2 thing. For mental health, it's not that. It doesn't work that way.
So many factors involved.
So many factors and so many perspectives. And we have to see it from every corner. So that is why for us treatment is difficult. But it's something that I'm sure all my friends we enjoy doing it because it's passion lah kan. We try to help. But it's something yang it takes time. It memang takes time. So we will never just jump the gun. Even for in my old hospital setting, they will have multiple point of views for this. We have this thing we call a grand ward round, whereby we have all the state psychiatrists, we have all the big consultants will come around and we'll discuss a case. Because we need all this extra input. Is there any corner which we did not see?
So we're talking about treatment now.
Treatment, sorry, we're talking about treatment. Okay, so I forgot. I jumped.
It's okay. I try to.
So for treatment. For mental health treatment per se, we would always try to classify it further into pharmacological or non-pharmacological. So this non-pharmacological, I would say it's the natural method lah. So according to our guidelines, and it depends on the severity of what we believe is this patient's level of whatever disease that they are going through. If we believe it's really bad, scoring system ke, ataupun kita tengok symptoms are very very bad, then we would definitely go for pharmacological methods on top of non-pharmacological methods. So we would complement these things. So the non-pharmacological methods are macam a lot of things. So if that patient is depending on the disease lah, but it could be psychotherapy,
talking to each other, and finding out the root cause.
That's one lah. That's one. Psychotherapy is a bit different. Then we have your cognitive behavioral therapies. We have your dialectical behavioral therapies.
What comes to my mind is electric shock treatment.
So that is also under non-pharmaco. We call that ECT, electroconvulsive therapy, whereby because we understand the EEG.
I have this image of people putting electrodes in your head.
I blame Hollywood for that, but it's actually there's multiple ways to do it.
But it exists.
It exists.
You still do electrical.
We still do it. So this thing is it's a generally safe procedure. But we don't do it for all cases. Only for those we have a quite strict, very very strict criteria. Who is allowed to do ECT and whatnot, and it will go through layers of. Let's say me as a medical officer, then we have to go through our pakar, all our specialists, and then they will see the case and then say, proceed. Because it's not the number one thing we do ECT. It's not called ECT lah. It's not number one. We only emergency cases that we actually have to do it. Yang we screw everything else. Contohnya lah. I mean, not for all cases. Let's say this patient is very psychotic and is not eating anymore.
That patient must be quite extreme lah.
Very extreme. Otherwise we don't do it.
You put some electrodes to the head.
So what we do is we put 2 electrodes to both temporal sides. Then we give a baseline shock. So we have levels of shock. Then we read the EEG the reading. So we try to shock it nicely. There's a nice wave that we look for.
Does it hurt then?
They are given sedation lah. They're given some mild forms of sedation. So I mean I've never done it for myself lah, obviously kan.
But you've done it to people.
Of course. We have to do it, and most of them become better. Or even those patients yang dah makan ubat pun tak boleh. So there are cases.
It's effective then. Is this historical?
It's definitely because it's practiced all over the world. We have to do ECT, and even before we do the ECT, we'll always call the family members for consent. We don't simply do things like I want to shock. So because we treat these patients, all patients with human rights, even if they are unable to give consent, we don't simply say this guy's not well.
They must approve also.
Even if they cannot approve, so consent is something. If he's psychotic, he cannot make the consent. We'll call the next of kin, either the wife, the mother, the father, etc., and we'll explain to them what we are doing. okay, we'll be putting these 2 probes, so they will have risk of this and this, but the pros is this and the cons are this, percentage is this, we might have to do it multiple times. So if they agree to it, then we will do it. So usually that's the case lah. That's the case, yeah. So for treatment pun, for me, because there are so many doctors around the world.
Is it expensive? I mean, especially for the public. Where can they go if?
Okay, so my number one suggestion is always to go to your government facilities first lah, because it's much affordable, and the doctors there are really, really good. I mean, they're really good because they are trained seeing the masses. How I was trained, we
You were there, right?
Yeah, I was there. Yeah, so I went through the training.
Every day there's
every day we meet lots of cases and whatnot.
Tell me what's the worst case in your...
I cannot say lah. This is patient doctor confidentiality.
I'm not asking the name, but
I cannot. I mean, we try not to lah. We try not to say this case, especially on camera lah. But okay. But yeah, I mean, there are a lot of cases we have seen in many spectrums, can. So that's why I would always, of course,
it can be violent also.
Can be violent. Some do come violent, some don't. Some with maybe a police escort ke apa. So it depends. But ultimately, these people, they need help. So even if, depending on how you feel pun, if you are whichever spectrum, you teruk ke, you tak teruk ke, my first recommendation is always to go to the government hospital, because there are so many great minds there. So many great minds to help you out. But of course, I do not deny yang your waiting time is a bit long lah.
But you yourself, as an individual, must be willing to make that first step, right?
Betul.
But sometimes you don't know that you have this problem.
Betul. Yeah, so depends on your case, but most of the time we are in denial or we are in doubt because we're not sure. You're not sure. But so we always believe that if you are in doubt, you see your level of functioning. If you can still function, I mean, there's no point you want to waste your time. I mean, if you have the money and luxury, sure, you can always go to private sector, or you can always just come, just book your appointment and see if you're okay. But usually, as an individual, as human nature, you won't want to go to the hospital unless you are unwell. So in mental health, usually the first time you do detect you are unwell is when things start to decline, things start to deteriorate a bit. So macam let's say teenagers ke apa, contoh macam
your parents
teenagers
realize you don't go out, you don't do anything.
Yeah, betul. So there's a decline in not just your cognitive function but also your social functioning. So you're self-isolating ke, you dah tak nak cakap dengan orang, kerja sekolah pun ataupun you're working, your KPIs dropping.
I think the most serious is suicidal, right?
Oh yes, definitely lah. So
how do you handle that? I mean, that's,
okay, so
let's say somebody out there finds a friend who is suicidal, what can they do?
Definitely they okay. So whenever if you do see these things also, or you know someone who is suicidal, never back off lah. Means it's not like bukanlah nak kata
say, listen lah, just comfort them.
Make sure you know they are available, because different people they have different ways where they want people to approach them. It's not that everyone must go and hug you. It's like no. Some they just need some space. But always keep it at the back of their minds that you're always there. And you have to always look out for them lah. So it's if you are in the liberty of being in the same space as them, macam roommates ke apa kan, housemates ke office mates, so you have to watch out for them lah. Kata tiba-tiba dia ni dah have a pisau for no reason, or dah start writing long notes of I want to say goodbye.
Can this happen to Muslim as well?
Why not? Okay,
because
why
it's
not?
against our religion
Betul.
to commit suicide, but it can happen to all religion, right?
It can happen, because this thing is despite, regardless your religion, you are Muslim, you are Christian, you are Buddhist, even if you're an atheist, right, you are still human. That means you are still bound.
The tendency is there.
You are still bound by human biological laws of hormones and physiology. So despite me being Muslim or another person not, we still have to breathe in oxygen. It doesn't matter. You bleed, you still bleed red color. So you're still human. So for us in psychiatry, we do not see you as you're a white man, you're an Asian. We do not see you. We see you as an individual, because the circumstances are the same.
So for the friend who has you can only advise and talk them out of it, or see the beauty of life and stuff.
It's hard.
Alternatively, I mean, what can they do? There place they can call or reach out?
That's why. So government facilities always
there.
Always there. Whenever you're suicidal, always. I mean, that's the best help for because government facilities are banyak all over.
You're right.
And we are. I mean, and everyone is emphasizing mostly on mental health nowadays because they know it's something you need help. if you really don't know where to seek help, always go there. It's always to, at least you have doctors there. You have people around you to help you out there.
Is Malaysia established to handle mental health?
Sure, of course we are. We are much established. We
but
are
it's
much
something
trained.
all these people don't really look into mental health issue around the world, I thought.
It's starting to pick up, like I said. So because like I said, mental health has always been on the rise.
Right.
Cumanya when pandemic, when everyone was at home playing,
that's when it started all.
no, it started to be aware. People started to be aware. The disease was, it's like, okay, so for example, dengue. Let's say dengue cases.
Right.
So in PJ is always hotspot lah, in KL and whatnot. Dengue is always high. So let's say in 2000, I mean, don't quote me on this, but roughly the statistics is like, let's say in the year 2000, let's say it was 100 cases, let's say. Okay, but then in 2 years later, it's 200 cases. But actually, if you see it retrospectively, in 2000, the first year too, it's actually 300, 400 cases. Basically, the difference is what is reported or not. It's the same as mental health. Last time, the cases are always there. The difference is post-pandemic, people started to report it. People started to acknowledge it. That's only when the numbers actually we could get data. It's like, oh, actually it's a lot, but we already knew it was a lot. It's just like dengue. We always knew that place was a hotspot.
Do you think the rise is also partly because of our modern society or technology? Is this something? Because in the kampung those days, they're not
simple
many
times. You mean simple times? Yeah.
Do you think it?
Yeah, I believe.
Affects?
Okay, so it could be controversial. It depends on the
your belief lah.
It depends on your belief. So based on me as an individual, not for macam representing anyone or anything.
Course, I understand.
But as an individual who has seen a lot of cases, who has worked in this space for quite some time, I do believe social media plays a big role.
Really?
Social media plays a big role in rising cases of anxiety, depression, and stress. For example, everyone is nowadays. This is just my opinion.
Right, sure.
Because we're keeping it real, kan?
Keeping it real.
Keeping it real. So
stop the social media marketing.
So
anyway, sorry.
I believe that. Okay, so for example, we tend to post our lives online.
We like to do that.
And it's human nature whereby we get recognition for it.
Correct.
So it's this like dopamine that we get. It's
right.
So let's say I post a photo of me going on holiday.
Yes.
And 100 people like I'm like, I'm so happy.
Yes, right.
So okay, so for you get that euphoria from it.
Correct.
Okay, but you're just posting it on a very very shallow surface level. But padahal you kat rumah you penat je. You're very tired on that vacation and whatnot.
Right.
So let's say you have another individual.
Right.
Who doesn't have that much luxury to go out.
Right.
Let's say I don't have.
Yeah.
And then I see my friend always going to Italy, going to Rome. There's this sense of comparison.
Like jealousy.
And then macam, so the thing
I'm not good enough.
Yeah. I believe it is on the rise, especially with nowadays. Even if you do post good content, macam let's say we're doing something like this, there will always be people who don't like you.
Yeah.
Then when you
and
post
the haters
it, you have your haters and your cyberbullies.
Yeah, I mean the haters are ready to comment. And that will make you also depressed because once you expose yourself, you have to be ready to accept this hatred kind of comments. So if you're not, then you can go through depression. I've seen some friends like that.
Yeah, definitely. So I believe, my personal opinion is I believe that social media plays a big role.
Right.
It influences a lot of people. What you see online is how you are influenced.
But we are doing it to ourselves. It's our human nature. But if we try to... Actually, it's good to stay away, and if you're not a strong character, it's best to stay away, I think.
True. Okay, true. So, and strong characters are something very subjective. It's subjective. If you believe you are strong, Macam for me personally, I know I'm just an okay guy.
All right.
And what I realized for myself personally is I've actually abstained from social media a lot. Because I'm a millennial.
I would do the same.
So I grew up in the generation of Facebook.
Right.
And I saw a lot of things, and it changed me, changed my friends and whatnot. So ever since I started, because I have a good friend, he advises me a lot. He reads a lot of psychological books, a lot of books of mind and whatnot.
Right.
So he told me that, hey, why don't you go for a detox, a social media detox? So I did it for 1 month.
You're serious?
Yeah.
There is such a thing?
Yeah.
There is a social media
detox or a dopamine detox.
Okay.
So but I did it specifically for social media. So my Instagram accounts, my Facebook, my Twitter, I just deactivated it for 1 month. That was the happiest 1 month of my life. I was very blessed.
Yeah.
And to a certain extent, where I just continued it, but now I'm just there for family.
Right.
I mean, I don't open it. I just open it if my sister like, hey,
unless you're doing business.
Unless you're doing business.
I have no choice. I prefer not to be on social media, but this is my CS, so I'm giving back to society. I enjoy it, so that's why I'm on social media. Otherwise, I try to avoid it, and the more I see, in fact, recently been watching about Palestinian and Israel war, I get so depressed. Every day there's stories, and I get so engrossed in it, and I feel very depressing for me. But for others, may take it even differently.
Yeah.
They might take it very seriously.
Yeah.
So sometimes I feel it's best not to look at it. But then again, I want to be part of the change in the world. So I have to be knowledgeable what's going on.
Betul. So much. I believe everything now we have is actually people have to consider it as a tool.
Yes.
It's like a credit card.
Yeah.
If you have a credit card, some train of thought will say the credit card is a very bad thing, but some will say it's very good. So it depends on how you use the tool.
Right.
So if you're using it just to buy the latest phone lah, laptop lah, then it's a bad debt. But if you're using it for your monthly investments and just to pay bills, it's good.
Yeah.
There's always there's a good debt and there's a bad debt. It's same as social media. If they actually use it as a tool and nothing more than a tool, then it should be just a tool, a platform for us to connect socially. Oh, my mom, I want to show my mom some nice photos, right? Yeah, it should just be
It can be so dangerous. People are so hooked up on phone. They can walk crossing the road, looking at the phone, can get run down.
Yeah.
So I mean, that is crazy.
That's not. Yeah.
I think everywhere you go in a family, I see everybody's talking. Even mom and dad. It's crazy. We're not talking to each other anymore. That is the future.
But it's up to us lah. It's up to us if we want. Because I know a lot of my friends and my close friends and family, whereby they do this thing with their young is very reduced screen time. They don't allow it. Yeah, because it's good. Right? You have a healthy family.
It is addictive. It's so addictive.
It's definitely addictive.
I'm glad you mentioned this. It's something that I believe you're right. I always feel that I need to control the amount of. I can't imagine it for myself. What about the younger generation? They're hooked totally.
But again, like I said, it's a tool.
Yeah,
it's a tool. So for us to say you are hooked on something is not fair.
Yeah, true.
So because everyone, so for me and you and the kids younger than us, we are of very different generations.
Right.
Because there was a comparison done, and I saw this. I don't know if it was as a joke or something.
Okay.
But so they were comparing that on the train. There was one photo, that's a funny photo.
Okay.
On the train, this guy was saying, everyone is just playing their phones. Right. Everyone's just looking down on their phones. Everyone becomes zombies, blah blah blah.
Okay.
Then he showed there was another photo in the 1950s or 1800s, whatever. All men on the newspaper on the train, all just reading newspapers by themselves. Yes. It's the same thing. It's the same thing. Only it's just presented differently for a different generation.
But less information being presented to you compared to today. You're bombarded with.
Yeah, definitely.
I mean, I wish I could just take the important information, but unfortunately, all rubbish come to you.
You can.
Yeah.
You can, but you have to select it. It because it's a tool. Yeah. So if you have allowed it to make you go down its deep rabbit hole, then you ultimately you are the product lah. But if you just, for me, I use it as a tool. I only use it for information that I need. Right. If not, my phone is at home. My phone is always somewhere else. Yeah, that's why I mean.
I try to cut down wherever I can. But only recently, because of the war, I'm so hooked up about it.
Yeah, definitely.
We get so depressed.
Yeah. So
I mean, this topic is never ending. It's really so much to cover. So this is just the beginning and introduction. But
let's hope we can continue it.
Yeah. And what is your message you want to give about mental health to the public?
So my message to the public is. It doesn't matter what generation you are from. It doesn't matter who you are, but mental health issues are there. I think I want everyone to just first acknowledge it and just realize that it's there, but it doesn't mean we cannot do anything about it. I hope that you do see out your close friends, families, and colleagues regarding how they are and how you are, and look deep down inside. Are you okay? Because if you are not, or you have doubts about yourself, that's the best time to read up, or the best time to seek professional help. There's so many hotlines out there. I'm sure you're just one Google click away from some hotline, and do ask so that you clarify your doubts, and it just makes you generally better lah.
Okay, good. Thanks for. Normally, I end up with a short question for my guest.
Sure. What is it? Give it to me. I'm ready.
Okay, assuming we can put the clock back to your younger days, would you have would you have done something different?
Younger days. I mean, just for me lah.
Yeah, you in particular.
This is the easiest question I've ever had.
What would you do
if I could go back in time? Talk to my younger self.
Okay.
I would specifically. Okay. For me, I believe there was a point in my life where I always had this thought. So, if I could just go back and I just change it. Everyone. Okay, I'm sure everyone have. But after a while, after a while, and after many hardships everyone goes through. So after the personal hardships I went through, I realized no. I believe that this path that I went through is the best for me, because it has made me who I am, for all the bad and all the good. So I'm actually happy. With all my flaws, I'm still actually happy, and I believe I can do better. So I wouldn't change anything but one. One thing I would change.
What, getting married?
No. If I would say get married earlier. Get married earlier.
They just got a child.
I just got a baby. Best baby, so makes you a better person. Okay.
So hard to get him.
Very busy now. Busy dad.
Yes.
Okay, so but I would change one thing only, is that I would see so now I am 30. I would go back in time to 2012. I think I was 17 at the time.
Okay.
I would just tell myself, bro, Syahir, invest in crypto. That's the only thing.
That's on hindsight.
That's the only thing. I was like, other than that, don't change anything. I would just say, hey, you take this $50, put it in there, then you just continue your life. Do everything as you did it. Don't worry. That's the only thing I would say.
Okay, right. I mean, that's on hindsight. Otherwise, you don't know what happens to crypto. Now, don't buy.
Now you evaluate first.
Anyway, it's an interesting chat, a new topic. Hopefully, Dr. Syahir will join us and some more information to share with us. And don't forget to subscribe to my channel and hit the notification bell. It will help us to grow. And this hopefully has given you value to help ordinary people out there. This information to make us improve our lives. And thank you again. Keep it real out there.
All right, bye guys.
Yes, thank you so much.
Out.